This is the Christmas picture from last Christmas.
Zelko Krjancic grew up in this bungalow overlooking the Garden City Skyway in St. Catharines. His mother, a Croatian immigrant and eldest of 8, raised him. He now spends 6 days a week with her at Extendicare long-term care home. She's 91, has dementia, and tested positive for coronavirus today.
I've had mixed emotions. Of course, I was scared, but I can't take her out because she's immobile. She needs help in every phases of care.
Krjancic says he has nothing against the caregivers at Extendicare. His blame is directed higher up. While Zelko is upset that he just found out that his 91-year-old mother just tested positive for coronavirus, he says what's more frustrating is the fact that this could have been prevented during the lull in the summertime between wave 1 and wave 2.
If the government was more proactive as opposed to reactive, it could have been perhaps contained a little bit more.
Dr. Vivian Stamatopoulos is a long-term care advocate who points out that the Ford government only had to look to our provincial neighbors in Quebec to see how we could have better protected Ontario's most vulnerable.
Started a staffing blitz at the beginning of June, and what they did was they set out to offer paid training and a starting salary of $50,000 for their equivalent of PSWs over there. And they were able to get about 10,000 before the end of September.
Stamatopoulos says that's not all Quebec got right.
Have independent IPAC leads at each home, so infection prevention and control managers at each home. Again, something that Quebec has been doing for months very successfully. I mean, those two things would have done so much to protect our sector ahead of the second wave.
During the first wave, 14% of Quebec's LTCs had more than 50 cases per 100 beds. In the second wave, that plummeted to 2%. Likewise, the amount of homes reported at least one case dropped from 39% in the first wave to 26% in the second. In terms of the vaccine rollout, the province announced on Tuesday that it plans to have all residents and staff vaccinated across all hotspots by January 21st. However, Stamatopoulos points out that some regions, like Niagara, have been left out, a move that could have dire consequences.
Which is exploding right now, which is on fire. There's over 25 current outbreaks, and they're exploding outbreaks. These are many very dangerous, large-scale outbreaks that will be eventually mass casualty events.
Zelko hopes his mother can avoid this fate. Extendicare tells CHCH that they're adding additional staff members as they continue to work closely with public health and Niagara region.